Wait, can you just stop scrolling for a second? Everyone talks about high blood pressure. Some are even scared of it. But then, what if I told you low blood pressure can be as dangerous as high blood pressure? And now, what if the dizziness, tiredness, and even blurred vision you keep ignoring is your body warning you? So for that, let's talk about what really causes low blood pressure. And if you see me for the first time, I remain your pharmacist, Adamaka. Welcome to Aster-Care Arena. Low blood pressure, you see, is what is also called hypotension. Is when your reading falls below 90/60 millimeter mercury. But then, some people have naturally low blood pressure and still feel fine. But for others, it can be actually dangerous. So today, I'm going to discuss the common causes of low BP, the hidden medical triggers, and when it becomes an emergency. Before I continue, let me give you a quick explanation of what blood pressure is. Blood pressure is the force pushing the blood towards your arteries, and if it drops too low, your brain and organs may not get enough oxygen, and that is when symptoms start. Dehydration is the #1 cause of low blood pressure, and this dehydration could result from not drinking enough water, excessive sweating, vomiting, or even diarrhea. This is because when the body loses fluid, your blood volume drops, and when that happens, so does your blood pressure. So take for instance, you are in this country, Nigeria, with very high heat, and you are not well hydrated. This alone can also cause it. #2 cause of low blood pressure is sudden standing. Have you ever stood up and suddenly felt dizzy? This is what is usually called the orthostatic hypotension. When such happens, your blood pulls in your leg and your brain doesn't get enough blood fast. So, because the brain is not getting enough blood, you as a person will feel lightheaded. This kind of hypotension is usually common in older adults, but then it can be seen in people who skip meals. That is, if you don't eat for a long period of time, it tends to happen to such a person. So those that skip meals should actually pay attention and monitor their body. Are you aware that heart problem could also cause low BP? So if your heart isn't pumping properly, what I mean is this: it could be slow heart rate, heart valve problem, or people with heart failure. Any of these conditions could actually cause the blood pressure to drop. Do you know that even when the pump is weak, the pressure drops? The #4 cause that could actually surprise you is something you may not even expect, is severe infection. Are you aware that severe infections can cause a dangerous drop in blood pressure? And if you don't know, such condition is what is referred to as septic shock. This condition I just mentioned is actually life-threatening and requires emergency treatment. Pay attention to your body. If someone with infection becomes confused or extremely weak, that is no longer normal. Pay attention, the person may be needing an urgent, proper medical attention. Another thing or condition that could possibly cause low BP is blood loss. Someone having internal bleeding, heavy menstrual bleeding, or even accidents can possibly have low blood pressure. Do you know why this is so? It is because when you lose a lot of blood, pressure drops fast. Another thing that can also cause low blood pressure is medications. Are you aware that some medication can actually lower the blood pressure so much? Examples include the blood pressure medication. That is why it is important while on your medication, you monitor your blood pressure so that it doesn't go low beyond normal. Some antidepressants can also cause that. Even some erectile dysfunction drugs lowers the blood pressure. So for this, never you adjust your medication without medical advice from your healthcare provider. Another possible cause of low blood pressure is hormonal problems. Are you aware that conditions like adrenal problem or thyroid disorders can affect blood pressure regulation? And this is why I always advise people unexplained persistent low blood pressure need proper evaluation. Do not ignore. So another question that should come to your mind is, why is low blood pressure dangerous? Low blood pressure becomes dangerous when it causes fainting, chest pain, confusion, cold clammy skin, weak rapid pulse. So if you are the person or you know someone that has a low blood pressure and is experiencing all of this, or most of them, even few of the listed, please, you need an urgent care. Pay attention to your health. So I will give this practical advice. If you often feel dizzy, try to stay hydrated. Keep yourself hydrated. Drink enough water, fluid, or fruits that can hydrate you well. Stand up slowly. Eat regular meal. What I mean by this is, do not stay too long without food. It affects one. It also affects the blood pressure. Monitor your blood pressure regularly. And finally, review your medication with your pharmacist or doctor. Even low blood pressure deserves attention like high blood pressure, because low blood pressure is not always harmless. Sometimes it's nothing, but then sometimes it's a warning. I hope you know your body actually whispers before it screams.
Wow.
Listen to it, and don't forget to like this, comment and share with someone who needs it. Subscribe if you've not for more practical health education tips. Bye.